Hi everyone. In many cartoon series, we can always see the eyeballs of the cartoon characters popping out when they are frightened or excited, and their eyeballs can be back to the original position. However, it is impossible to human that the eyes popped out for such a long distance without permanent damages. According to the Guinness World Records, the farthest distance of human eyeball popped is made by KIM GOODMAN, who can freely control to pop out eyeballs by herself like this video. Instead, the reason behind is called the exophthalmos. Below, our group would introduce this eye disease, exophthalmos. According to the Gale Encyclopedia of Medicine, exophthalmos is defined as when there is an increase in the volume of the tissue behind the eyes will appear to bulge out of the face. In most cases, the tissue contents swell due to inflammation and the pressure accumulated and force the eyes forward. Primarily, the inflammation affects the eye muscles. This combination of muscle impairment and forward displacement reduces eye movement, causing double vision and strabismus. Also, the vision loss might be caused by compression of the optic nerve. The conjunctiva might also swell due to the inflammation at the back. Last but not least, the eyelids cannot close normally as the eye's protrusion develops, just as the cherry eye in dogs. Patient possibly suffer painful, dry and itchy eyes, redness, photophobia, and even corneal damage. Consecutively, we summarize 3 major causes for exophthalmos. Firstly, thyroid ophthalmopathy is the most common cause of exophthalmos. 20% to 50% of the patients with thyroid problems would associate it with exophthalmos. This is a kind of autoimmune disorder, which the immune system mistakenly attacks the healthy and fatty tissue. Thus, the fatty tissue behind the eye will get inflammation and push the eye forward. Secondly, head trauma may affect the eye sockets and push the eye forward. Kim, the record keeper, indeed discovered her talent when she was hit on the head by a hockey mask. As a matter of fact, infection of tissue around the eye, such as orbital cellulitis, will cause pressure abnormalities within the brain. The eye condition is therefore altered and presumably leads to bulging. Thirdly, certain group of people is genetically found to have higher risk of developing exophthalmos. It can be divided by genders and races. Some research found that the thyroid orbitopathy has a female preponderance, with a female to male ratio of 5 to 1. A research reported a frequency of 2.9 cases per 100,000 population per year in men, and 16 cases per 100,000 population per year in women. Researchers found that the adult African males averagely protrudes 18.5 millimeters, with the upper limit of 24.7 millimeters. Thereupon, the prevalence of suffering from exophthalmos is higher in the Europeans, at a rate of 42% versus 7.7% in Asians. It is about 6.4 times. To date, neither thyroid ophthalmopathy nor head trauma are precisely preventable. Therefore, maintaining healthy lifestyle may immediately reduce the odds of illness. Following are some tips for you to embrace a healthy lifestyle. Firstly, quit smoking. Malfunction of the immune system could be stimulated by the elementing cigarette. Thus, quit smoking would simply remove the risk factor of thyroid ophthalmopathy. Secondly, get regular eye checkup. Eye doctor is able to detect early signs of serious health problems. So eye examination should be part of people's normal health routine, especially for the newborn and aging eyes. Thirdly, reduce stress. Autoimmune disorder usually associates with stress. In this way, keep in mind to relax your mind and body, then help ease stress. Finally, a safety mind. Don't forget the protective gear as serious incidents can spring up when you least expect them. Stay alert for possible threats for eyes including particles, light, wind blast, heat, sea spray, or some type of ball or puck used in sports. Thank you.